Hello everyone, welcome back to my pharmacology YouTube channel. Today we will dive into an essential topic in pharmacology, that is routes of drug administration. As aspiring healthcare professional, understanding the various routes through which medications can be administered is crucial for safe and effective patient care. Throughout this lecture, we will explore different routes of administration, their advantages and their disadvantages. So let's get started. So what is route of administration? The path taken by the drug to get into the body is known as the route of drug administration. Route of administration influence drug absorption, distribution, metabolism, excretion, which directly impact the therapeutic outcomes. Routes of administrations are divided into two types: anterior route of administration and parenteral route of administration. Anterior route of administration is through the alimentary canal. They are further divided into oral route, sublingual route, buccal route and rectal route. Now we will discuss all these routes of administration one by one. We will discuss their advantages and their disadvantages. So we are going to start with oral route of administration. Oral route is the most common route of drug administration. It may be in the form of tablet, capsules, syrups, emulsions and powders. The drugs may be in the form of all these tablets, capsules, syrups and powders and emulsions. There are many advantages of the oral route of administration, like it is the most convenient route of administration. It is the cheapest available route. Like tablets and syrups available in the market are cheaper than the drugs available in the market that can be given through the intravenous route. It is easy to use. Patient can self-administer through the oral route of administration. It is safe and acceptable route of drug administration. So there are many disadvantages of oral route of administration. Less amount of drug reaches the target tissue. Some of the drug is destroyed by the gastric juices. Absorption has to take place, which is slow, so is not preferred during emergency situation. This route might cause gastric irritation. The taste might be bitter. The drugs taken through the oral route of administration might cause discoloration of teeth. Like oral tablets can cause staining of the teeth. Tetracycline below 14 years of age can cause brown discoloration, so are not advisable to take during pregnancy. And the most important disadvantage of oral route of administration is first pass effect. Now what is first pass effect? First pass effect is the term used for hepatic metabolism of the drug. When the drugs are absorbed and delivered through the portal vein to the liver, and metabolism of the drug takes place inside the liver. So greater the first pass effect, less amount of drug reach into the systemic circulation. Or in other words, we can say that the first pass effect refers to the rapid metabolism or degradation of a drug that occurs inside the liver or gut wall after oral administration. First pass effect significantly reduces the bioavailability of the drug, meaning the amount of the drug that reaches systemic circulation and produces its desired effect. There are factors which influence the magnitude of the first pass effect, and they include drug properties, liver enzyme activity, and rate of blood flow to the liver. There are drugs with high first pass metabolism. They require higher oral doses or alternative route of administration to achieve the therapeutic concentration. After oral route of administration, we have sublingual route, and sublingual route involves the placement of the tablets under the tongue. In this picture you can see that the tablet is placed under the tongue. There are many examples of the drug which are given through the sublingual route. Like the most important drug that can be given through the sublingual route is nitroglycerin. It is the anti-anginal drug. It is useful for the treatment of angina. Oxytocin can also be given through the sublingual route. Nifedipine, an antihypertensive drug, is used in hypertensive emergencies, given by the oral route. So there are advantages of the sublingual route, like the absorption through the sublingual route is rapid. Drug is dissolved easily through the sublingual route. Drug enters the blood directly because of the presence of small capillaries. There is less first pass effect, and spitting of the drug removes its effect. Patient can terminate the effect of the drug by spitting out the drug easily. So there are disadvantages also of the sublingual route. This method is convenient for many patients. Irritation of the mucous membrane can occur. Persons may swallow the drug. The drug might be unpleasant in taste. After sublingual route, we have buccal route. Buccal administration is where the dosage form or the drug is placed between the gums and the inner lining of the cheek. In this picture you can see the tablet is placed between the gums and inner lining of the cheek. Advantages of the buccal route. The onset of effect through this buccal route of administration is rapid. Again, there is less first pass effect. The action of the drug can be terminated by spitting out of the drug. Self-administration by the patient is possible. After advantages, there are disadvantages of the buccal route. Small dose of the drug can be given. We cannot give large amount of drug through the buccal route of administration. Irritation of the mucous membrane might occur, might be unpleasant in taste. Some people or some patients have difficulty keeping the drug on site, as well as requiring the patient to refrain from talking, drinking or swallowing during the administration. So for some people this route might be inconvenient. Lastly, we have rectal route of administration. Drugs in solid form such as suppositories or in liquid form such as enema are given by this rectal route. This route is mostly used in old patients or in young children. Drugs may have local or systemic actions after absorption. Now there are advantages and disadvantages of the rectal route. If we talk about the advantages, this route is preferred in unconscious patient or uncooperative patients. This route avoids nausea or vomiting, so we can administer anti-emetics drugs in patients who are vomiting, so we can administer those drugs to treat the vomiting through the rectal route, especially in children. Drugs cannot be destroyed by the enzymes, and this route is preferred if the drug is irritant. After advantages, we have some disadvantages of the rectal route. The most importantly, this route is generally not acceptable by the patient. Drugs given by rectal route have 50% first pass effect. So this is an advantage and this is a disadvantage also, because advantage is we can avoid 50% of the first pass effect, but disadvantage is there is 50% of first pass effect of the drug with this route. So understanding of the route of administration is essential for healthcare professional to ensure optimal drug therapy outcomes. By choosing the most appropriate route, we can achieve the desired drug levels in the body, considering factors like drug properties and patient specific conditions. Thank you for joining me on this journey through the route of administration in pharmacology. I hope you found this lecture informative and valuable for your understanding of the drug delivery in pharmacology. Be sure to like, share and subscribe to my channel for more educational content. Stay curious and see you in the next video.